Okay, I'll check. I know the meeting already started, but it's okay. I have to show you first how to do this IV. And just a reminder, when you're done, okay, just save the flush, okay, and then save this too. Okay, the only thing you throw away is this and then this. Okay, unless you want to save the tourniquet, that's also fine. Okay, so there you go. So the first thing you have to do is, of course, you have to find the vein first before you put tourniquet, before you do anything. Okay, so I mean, this is a mannequin, so it's different. So remember this, you don't want to start IV on this area because we have a lot of pain nerve endings in this area. So what you use is either the hand, okay, of the patient, or the antecubital fossa, or the brachiocephalic vein. Okay, we have two here actually going. It's the brachial going to the cephalic going to the head, right? So just before you start anything, since for this one we already see this is a good one, right? Or this one is a good one. So what you do is, of course, you prepare, you wash your hands, okay? You don't have to put your clean gloves yet, just prepare your stuff. So here, inside is sterile, so you don't want to touch anything inside.
They had also mentioned when we were learning, like, the IV therapy, that even, like, we want to start, if we're going to first try and stick someone, like, we want to start higher instead of, like, lower, because then we can't go back down.
No, you always start
You
lower,
start low and
lower
lower.
than going up.
Yeah.
Yeah.
It's low and then
It's always, yeah.
Lower.
I thought it was the opposite.
Yeah, lower going up. Okay. Okay, so you prepare first all of this. I don't prepare my tape. I know some nurses they do, but before I do that, before I tear up the tape and put it in the bedside table, I make sure that table is clean. Because remember, some patients, they put their food tray there, sometimes they put their urinal there. You know, just think about that before you put anything on the bedside table. And then prepare this. Okay, so I just open up everything. Okay, so now I think I'm good to go. This is my needle. Okay, and remember, I'm gonna show you with the needle and the cannula. When you get in and you got a blood return, what you only push all the way would be the cannula, not the needle, because when you push the needle too, you will lose that vein. Okay, so first you have to do is prepare your catheter. So you see this one, white, right? So with this one, you remove this. Okay, and you put it here.
That's smart to think of it like white to white.
Okay, and then flush. You don't have to remove that blue thing, you don't have to. So not touching that end, you put your flush, but make sure your flush doesn't have any air. If there's any air, then try to remove it. Okay, so let's see, just a little bit. Okay, and then I put it here. Okay, and then you flush it just a little bit so that the air is not there, because you don't want to push air to your patient. And then clamp it. You see this part, you clamp. Okay, so it's clamped. Now you put it back here. Okay, the thing with them is they're saying we cannot use this, so we'll just pretend that I pop it. Okay, so what you do is you put the tourniquet. Okay, and the thing with this is it has to be on, okay, so you can get a blood flow. if it's off, if it's clamped, you cannot get a blood flow. And do not clamp this tubing. So just for demonstration, you always put the tourniquet, you know, like at least 3 inches away from the site. And it has to be tight, so you have to let your patient know that, hey, it's gonna be tight. Can you get me a small gloves? Because I think this is too big. So I'm just to show you is that you do that, okay, and then you do this. It has to be really tight. Thank you, Mary. And then you do it this way.
It's not comfortable with your gloves.
Hmm?
With your gloves, it's not
It's
comfortable.
not. It has to be small. Okay. And you'll see some nurses, they will remove something on the index finger to feel the vein. Don't do that.
We saw that in
Because
our high school.
like this, they will remove it, and then you do that. Can't, okay? Especially the thing with Joint Commission is they don't like tell you when they're coming, nor ACA. Okay? So be very careful. Okay? So here, make sure this is really tight. Okay? Clean the site. Okay, but for this one, you have to check this tubing. Okay, for this one, we're gonna use this area. Okay, so you're gonna clean the site, right? Inward to going out. Okay, if you have another ChloraPrep, what you do is you do this way. Okay, so it depends on the policy. You have to check. So in the hospital I work at is I do in and out and then clean like this, okay, and then throw it away. So in short, I'm using 2 of this. Okay, so let's say I'm done, let it air dry. After that, this is the needle. Okay, every hospital has different one, so make sure you let your clinical instructor know. Okay, so here I'm gonna show you the cannula, right? So this is the cannula, the white one, and this is the needle. Okay, so make sure bevel up when you're